The Global Health Summit is an opportunity to share lessons learned from the COVID-19 pandemic. Global leaders and high-level experts will discuss how to improve health security, strengthen our health systems, and enhance Europe's ability to deal with future crises in a spirit of solidarity. Their goal is to create a Rome Declaration, including principles which can be a powerful guide for medium to long-term structural change brought about through international cooperation and joint action to prevent future global health crises. These principles will take into account the views of the scientific community and civil society. As part of that conversation, the Active Citizenship Network recently held the 15th European Patient Rights Day. Participants welcomed the European Commission President Ursula von der Leyen's clear statement in her September 2020 State of the Union address that it is a necessity to create a stronger European health union. The European Patients' Rights Day recognised the key role of patients' advocacy groups who give their account of the pandemic. They revealed the reforming force of civic organisations and their capacity to respond promptly to new healthcare needs by managing services and building alliances. This has also been the driver of the manifesto, with 10 concrete recommendations endorsed by more than 45 associations across the EU. It's addressed to the European institutions to highlight non-COVID patients' unmet needs and the urgency of building more resilient healthcare systems. The question now is, will political leaders at the Global Health Summit insist on the integration of civic and patients' organisations as part of the new strategy? Expectations are high. I spoke with some leading policymakers and analysts about the lessons learned during the COVID-19 pandemic, lessons which demonstrate how all countries need to work more closely together to improve global health security, and why patient advocacy groups must have a greater voice at the table.
The G20 Global Health Summit and the Rome Declaration are an excellent opportunity to reinforce cooperation and solidarity, but also to renew the commitments to reform, transform, and invest in health throughout the society. Furthermore, to engage with patients and citizens who have proven to be a powerful force and an inexhaustible source of innovative ideas and solutions for global and local challenges. We just had a meeting with the European Parliament Interest Group on integrated health and social care, where all these messages were reinforced, that we need to work together, we need to bring patients into the patient-centered healthcare, and we need to work across sectors to build back better and to have a better health and well-being for all.
First of all, we still perceive the need to better address the consequences of COVID-19 pandemic on non-communicable disease, for instance. Oncological and chronic patients have been left almost alone for a while during the pandemic, and the risk is to jeopardize 20 years of prevention. So health is more than COVID-19 free, and this situation needs immediate actions, as the ones suggested by our manifesto in 10 recommendations for more resilient healthcare system, drafted by Active Citizenship Network and endorsed by patient associations across Europe. Secondly, we have understood what must not happen again, among others, the limited access to public services and healthcare services. It's not acceptable to respond to immediate needs of the citizens simply closing healthcare services. So alternative solutions are needed to guarantee continuity and quality of care. Last but not least, even in crisis context, it is necessary to recognize in support of the local community and in support of the institutions, also the key role of the patient advocacy group, the citizens organization involved in healthcare issues, and all the actors that promote health as a common good.
As a first point, not to leave anyone behind, which is the cornerstone of the 2030 Agenda for Sustainable Development, adopted by all UN member states in 2015, a shared model for peace and prosperity for people and the planet, now and in the future. Ending poverty and other deprivation must go hand in hand with strategies that improve health and education, reduce inequalities, and stimulate economic growth, all by addressing at the same time the climate change and working to preserve our oceans and forests. So second point, to collaborate in research to create the conditions for more treatment possibilities, ensuring that patients have access to cheap medicines to address unmet medical needs of today. And finally, strengthening and giving stronger mandates to the European Centre for Disease Control and Prevention, the European Medicines Agency, and the new emergency agency which will certainly strengthen the capacity to predict, prepare for, anticipate, and respond to future health threats.
Principle of leadership, principle of coordination, and principle of responsibility to be responsive when we are signing global documents. We need to understand, we need to act and implement. It's our responsibility to see and to act and to keep in mind final results, not only signing declarations and then leaving everyone without responsibility.
Europe has begun to overcome the COVID crisis. There's a brighter horizon ahead. But Europe is still facing widespread public health crises, not least with cancer and chronic care. Without a health union, our resources are inefficiently used and our citizens suffer unnecessarily. Without a health union, widespread health inequality will remain. Patients' advocacy groups are the voice that needs to be heard to ensure fair and equal access to healthcare. The Rome Declaration is an opportunity to shape a public health policy which citizens will understand and welcome. It's time to act as one, for together we are stronger and together we're healthier.